Tonight's Woman's Doctor, being pregnant is hard enough, but as 11 News anchor Lacey Griffith explains, imagine being diagnosed with cancer during your pregnancy.
Well, melanoma is the most prevalent cancer during pregnancy, representing 31% of all gestational cancers, and that number is on the rise. Mercy Medical Center surgical oncologist Dr. Vadim Gushchin says pregnancy usually happens at a younger age, and so does melanoma. Dr. Gushchin says pregnancy does not speed up melanoma and does not worsen the prognosis. Surgery is the most common treatment for melanoma patients, and he says 8 out of 10 patients will usually be fine if treated with surgery alone.
So it's a good idea to check with the dermatologist about like pigmented lesions, stuff like that. Melanoma may accentuate pigmented lesions. So pigmentation that happens is a normal pregnancy sign, as you might know, but it's a good idea to establish the baseline.
Oh, he says you can easily look for the ABCs of melanoma yourself. A, asymmetry. Look for moles or lesions with an irregular shape. B, border. Melanoma borders may be scalloped, notched, or poorly defined. C, color. Melanoma can appear in various colors. D, diameter. Melanomas are usually larger than the size of a pencil eraser. And E, evolving. Pay attention to changes in a mole or lesion over time. And Mercy Medical Center OB/GYN Dr. Robert Atlas says, while it is rare for him to see a pregnant woman get diagnosed with melanoma, it does happen.
There's a patient recently who I had who, before she got pregnant, had a very special type of melanoma that you don't typically see. It involved the eye. And so, you know, it's one of those cancers that is concerning to us as obstetricians because it can metastasize to the fetus.
But he says most cancers do not metastasize to the fetus. But he adds that fetal growth can be affected by chemotherapy if that is the patient's treatment option. However, like Dr. Gushchin, Dr. Atlas agrees that most melanoma patients who are pregnant can be treated with surgery, and he says everyone should be getting a yearly skin evaluation. In the newsroom, I'm Lacey Griffith.